Hello everyone, welcome back to my YouTube channel. Today we'll study about expectorants and mucolytics. In the previous class already we have studied about the drugs affecting on the respiratory system. Under that already we have finished the anti-asthmatics, bronchodilators and decongestants. So today we'll start the expectorants and mucolytics. Here the expectorants and mucolytics both are different. Depend upon the severity of the conditions or depend upon the concentration of the drugs. These both are different. Here the expectorants are used for the treatment of mild and moderate coughs. Mild and moderate means mild and moderate respiratory tract infections ಏನಿರುತ್ತೆ ಆ ಒಂದು ಟ್ರೀಟ್ಮೆಂಟ್ ಗೆ expectorants ನ ಯೂಸ್ ಮಾಡ್ತಾರೆ. Then mucolytics, these are used for the treatment of severe or the chronic respiratory tract infections. Chronic respiratory tract infections. Okay, here first we'll study about the expectorant. Expectorants, these are a type of cough medicines used to help clear mucus from the airways. These are the type of cough medicines, means these are used to treat the cough, means cough medicines and used to help clear the mucus from the airways. Airways alli yavaga mucus productions excess agutte avaga matra the person may having the cough. Next, the mucolytics. Here the definition of mucolytics is a class of drugs that help to reduce the thickness and stickiness of the mucus in the lungs, making it easier to cough out. Okay, lytic is nothing but a breakdown. Okay, these mucolytics are breaking down the cuffs. Okay, cough andre kemmadu cough ಏನು ತುಂಬಿಕೊಂಡಿರುತ್ತೆ ಅದನ್ನ break down ಮಾಡಿ it will come out. So here these are the class of drugs that help to reduce the thickness and stickiness of the mucus in the lungs and making it easier to cough out. Okay, when you administer these mucolytics, the cough or the excessive mucus collections will come out. Okay, these are the definitions of expectorants and mucolytics. Next we'll see about the classification of expectorants. Here the expectorants are divided into two types. Those are secretion enhancer and mucolytics. Secretion enhancer are potassium citrate, potassium iodide, guaifenesin, toloblasam, Vasaka and ammonium chloride. These are the secretion enhancer expectorants. And next the mucolytics. Here the breakdown the cups the medicines which are used to treat the severe coughs. Here the example for this is bromohexanes, ambroxol, N-acetylcysteine and carbocystines. Next we'll see about the in detail explanation about these expectorants. Now we'll see the secretion enhancers. Here the example for secretion enhancer is potassium iodide. So potassium iodide is used to thin mucus and loosen the congestion in the chest and throat. Okay, secretion enhancer, these are comes under classification of the expectorants. So this is used to thin mucus and loosen the congestions in the chest and throat. ಅಂದ್ರೆ mucus ಏನಿರುತ್ತೆ ಅದನ್ನ thin ಮಾಡೋದಕ್ಕೆ ಯೂಸ್ ಮಾಡ್ತಾರೆ. ಆಮೇಲೆ chest and throat ಅಲ್ಲಿ ಏನೇನು mucus collection ಆಗಿ congestions ಆಗಿರುತ್ತೆ ಅದನ್ನ ಟ್ರೀಟ್ ಮಾಡೋದಕ್ಕೆ potassium iodide ನ ಯೂಸ್ ಮಾಡ್ತಾರೆ. So first we'll see the mechanism of action. Okay, here the mechanism of action means after the administration how the drug is going to act in the body. The mechanism of action is potassium iodide is thought to exert its expectorant properties by enhancing the fluidity of respiratory secretions. Okay, how it is going to work? It enhancing the fluidity of respiratory secretions. Adare respiratory secretions ಏನಿರುತ್ತೆ ಅದನ್ನ fluid ಆಗಿ ಕನ್ವರ್ಟ್ ಮಾಡೋದ್ರ ಮುಖಾಂತರ mechanism actions ನ ಮಾಡುತ್ತೆ. So then it leads to reducing the viscosity and making it easier to expel through the cough. Okay, once the mucus become fluid, once the mucus become fluid, it is lost its viscosity. Once it lost the viscosity, it will expel through the coughing. Okay, once it's lost its viscosity, it will expel, means it will come out through the coughing. So next we'll see the dose. This drug means potassium iodide is administered 100 to 300 mg orally TID. TID is thrice in a day and means 3 times in a day. Dose ಅನ್ನು 100 to 300 mg ವರೆಗೂ orally ಕೊಡಬಹುದು 3 times. Okay, daily 3 times after the food. And next we'll see about the pharmacokinetics. The meaning of pharmacokinetic is nothing but what body does to the drug. What the body does to the drug. And pharmacodynamic is nothing but what the drug does to the body. Okay, pharmacokinetics ಅಂದ್ರೆ administration drug ನ administer ಮಾಡಿದ್ಮೇಲೆ ಬಾಡಿಲಿ ಯಾವ ತರ interact ಆಗುತ್ತೆ. So here rapidly absorbed orally and widely distributed means the absorption. While studying about the pharmacokinetics, you should know about the mechanism, that is an absorption, distribution, metabolism and excretion. Okay, here the absorption, rapidly absorbed orally and widely distributed. The absorption is mainly occurs through the oral cavity. Means this drug is mainly rapidly absorbing through the orally and widely distributed. And next it leads to distribution to the respiratory secretions is unclear. And respiratory secretions ಏನಿರುತ್ತೆ ಅಲ್ಲಿ ಅದರಿಂದ distribute ಆಗುತ್ತೆ. Then it leads to, it undergoes minimal metabolism. Metabolism, it usually occurs in the liver. Okay, the drug metabolism is usually occurs in the liver. Then it leads to excreted through urine, sweat and saliva. Means ಇವಾಗ drug administration ಮಾಡಿದ್ರೆ ಅಬ್ಸಾರ್ಪ್ಷನ್ ಆಗಬೇಕು, ಅಲ್ಲಿಂದ ಡಿಸ್ಟ್ರಿಬ್ಯೂಷನ್ ಆಗಬೇಕು, ಡಿಸ್ಟ್ರಿಬ್ಯೂಷನ್ ಆದ್ಮೇಲೆ ಮೆಟಾಬಾಲಿಸಮ್, ಲಿವರ್ ಅಲ್ಲಿ ಮೆಟಾಬಾಲಿಸಮ್ ಆಗಿ ರಿಮೈನಿಂಗ್ ವೇಸ್ಟ್ ಪ್ರಾಡಕ್ಟ್ ಏನಿರುತ್ತೆ ಅದು ಇಟ್ ಶುಡ್ excrete through urine. If it is not excrete through urine, it is going to keep on depositing or the lodging in the body. Okay, keep on depositing and then it is going to settle in the body. Then it leads to the toxicity, drug toxicity. To avoid this toxicity, the drug should excrete through the urine or the sweat and saliva. Okay, because it is an expectorant, obviously it should excrete through the saliva. Next we'll see about the side effects of potassium iodide. So here after the administration, the patient may feel the nausea and vomiting and stomach pain, that is a GI discomfort. GI and gastrointestinal discomfort. Gastrointestinal discomfort, and then the patient may feel the diarrhea. And next, skin rashes and itching. Skin rashes, itching and swelling of the face and the throat. These all comes under the hypersensitivity reaction. Hypersensitivity reaction. If the patient is having the history of hypersensitivity reactions, if without knowing the hypersensitivity reaction history, if you administer these drugs, the patient may having the skin rashes, itching, swelling of the face or the throat. And next, thyroid dysfunctions and leads to the iodism. Andre patients ಗೆ ಏನಾದ್ರು hyperthyroidism ಅಥವಾ hypothyroidism, normal thyroid functions ಇರಲಿಲ್ಲ, ಆ ಒಂದು ಟೈಮ್ ನಲ್ಲಿ ನೀವೇನಾದ್ರೂ potassium iodide ನ administer ಮಾಡಿದ್ರೆ the condition may be worse. Means the patient may lead to the severe iodism, increased level of the iodine. Okay, and next is drug interactions. Drug interactions, here these drugs are interacting with lithium, anti-thyroid drugs, angiotensin converting enzyme inhibitors. Okay, ACE inhibitors are nothing but angiotensin converting enzyme inhibitors, potassium supplements and anticoagulants. Okay, drug interactions, these drugs are used with the combinations with other drugs. Those are lithium, anti-thyroid drugs, ACE inhibitors, angiotensin converting enzyme inhibitors, potassium supplements and anticoagulants. Toxicity. Next we'll see about the toxicity. Toxicity is nothing but poison. Means when you are administering the excessive level of the potassium iodide, it may leads to hypercalcemia, because here we are administering the two combination of drugs, that is potassium and iodide. When you administer the excessive level, if the patient is consuming in a prolonged period of the time, it may lead to the hypercalcemia. It is nothing but an increased level of potassium. Increased level of potassium in the blood. And next, iodism is nothing but increased level of iodine. And next, if the iodine level is increased, obviously the patient may having the thyroid dysfunctions. Okay. And next, contraindications. Contraindications are nothing but in which conditions we should not administer the potassium iodide. If the patient is having the hypersensitivity reaction, we should not administer. If the patient is having any thyroid dysfunctions, should not advise the potassium iodide. Next, we'll see about guaifenesin. Means this drug is used as a secretion enhancer. Here, it is commonly used cough medicines that helps to loosen the thin mucus in the airways. Okay, it helps to loosen the thin mucus which is present in the airways and making easier and clear the airways. Okay, guaifenesin, it is used, yake use ಮಾಡ್ತಾರೆ ಅಂದ್ರೆ is a commonly used cough medicines. Okay, it is commonly used in a cough medicines that helps to loosen the thin mucus. ಅಂದ್ರೆ airways ಅಲ್ಲಿ ಏನಾದರೂ thin mucus ಇದ್ರೆ ಅದನ್ನ ಕ್ಲಿಯರ್ ಮಾಡೋದಕ್ಕೆ guaifenesin ಯೂಸ್ ಮಾಡ್ತಾರೆ. Here the dosage. Next we'll see about the dosage of the guaifenesin. Here, according to the age group and then dosage. Here the age group adults and 12 years and older. Okay, adults 12 years ಆಗಿರ್ತಾರೆ ಅವರಿಗೆ, ಆಮೇಲೆ ಅವರಿಗಿಂತ ದೊಡ್ಡವರು ಅಥವಾ ಓಲ್ಡರ್ಸ್ಗೆ here it should be administered 200 to 400 mg every 4 hours, not exceeds 2.4 grams per day. Means it is used 200 to 400 mg every 4 hours. Means 200 into 4, this is 800 mg, and next 400 into 4, 400 mg, and time, this is 1600 mg at the 1.5 gram, sorry 1.6 gram. Okay, these drugs are administered only 800 to 1600 mg with the duration of 4 years, sorry, with the duration of 4 hours, and it should not be exceed 2.4 grams are nothing but 2400 mg. Okay, per day is nothing but 24 hours. Within 24 hours ಅಲ್ಲಿ it should not exceed ಅಂದ್ರೆ 2400 mg ಗಿಂತ ಜಾಸ್ತಿ ಕೊಡೋ ಹಾಗಿಲ್ಲ, only limited 800 to 1600 mg ವರೆಗೂ ನೀವು per day ಕೊಡಬಹುದು. And next, for the children's 6 to 11 years. For 6 to 11 years children, 100 to 200 mg for every 4 hours and not exceeds more than 1.2 grams per day. 1.2 gram is nothing but 1200 mg. ಅಂದ್ರೆ within 24 hours ಅಲ್ಲಿ 1200 mg below ಕೊಡಬಹುದು, ಅದನ್ನ ಎಕ್ಸೀಡ್ ಮಾಡಿ ಕೊಡೋಂಗಿಲ್ಲ. And next, for the children 4 to 5 years, ಅಂದ್ರೆ 4 to 5 years children ಯಾರಿರ್ತಾರೆ ಅವರಿಗೆ 50 to 100 mg. Okay, 50 to 100 mg ನ ಕೊಡಬಹುದು for every 4 hours. It should not exceed more than 600 mg per day. Means within 24 hours ಅಲ್ಲಿ 600 mg ನ ಕ್ರಾಸ್ ಹೋಗೋಗಿಲ್ಲ. And next, children 2 to 3 years, it is administered 25 to 50 mg for every 4 hours and it should not exceed more than 300 mg per day. Okay, children ಯಾರು 2 to 3 years ಇರ್ತಾರೆ ಅವರಿಗೆ 25 to 50 mg up to 4 hours ಅಂದ್ರೆ sorry 4 hours ಅಲ್ಲಿ ಕೊಡಬಹುದು. For every 4 hours, the QID every 4 hours ಗೆ 25 to 50 mg ಕೊಡಬಹುದು. should not exceed more than the 300 mg per day. ಅಂದ್ರೆ one day ಗೆ 24 hours ಗೆ 2 to 3 years ಇರೋ children's ಗೆ 300 mg ನ ಕ್ರಾಸ್ ಆಗೋಗಿಲ್ಲ. And next, infants under the 2 years. Infants under 2 years depend upon the severity of the condition, age and baby weight. The pediatrician is going to advise the medications. Okay, before administration of the drugs to the infants under 2 years, you should take the prior intimation from the pediatrician. Means he is going to prescribe the medication depend upon the age and the severity of the condition as well as the body weight of the baby. Okay, means if we administer these drugs more than the exceed, means ಅಂದ್ರೆ ನಾರ್ಮಲ್ ಆಗಿ ಎಷ್ಟು ಕೊಡಬೇಕು ಅದಕ್ಕಿಂತ ಜಾಸ್ತಿ ಕೊಟ್ಟರೆ ಏನಾಗುತ್ತೆ, it may causes the toxicity. Okay, this is the definition and dosage of guaifenesin. Next we'll see about the side effects. Okay, the side effects are more common like in other drugs. The patient may feel the nausea and vomiting, GI disturbances, diarrhea and sleepiness. Sometimes the patient may feel the hypersensitivity reactions. Those are in skin rashes, itching and swelling of the face, and sometimes the patient may feel the thickness of the tongue. Okay, means also the patient may feel the slurred speech, andre correct agi maatadodakke baralla. Slurred speech andre nalige enadru tappa aitu andre the patient may not talk normally. Okay, this is a side effects of the guaifenesin. And here next we'll see about the pharmacokinetics. Pharmacokinetics, already I thought about this. Pharmacokinetics means it includes pharmacokinetic, what the body does to the drug. Here the pharmacokinetics includes the 4 stages, that is an absorption, distribution, metabolism and excretion. Okay, absorption it rapidly absorbs through the orally, and distribution it occurs through the blood or other mucus secretion, and metabolism it occurs in the liver, and excretion it occurs through the urine. Okay, excretion is mainly occurs in the kidney. Okay, kidney dinda enagutte urine excrete agibidutte. So this is an pharmacokinetic of a secretion enhancer, that is an guaifenesins. And next we'll see about toxicity. Guaifenesin administrations ಮಾಡಿದ್ಮೇಲೆ intoxicity ಆಗುತ್ತೆ. Means it is having the low toxicity. High doses may cause the gastrointestinal upset. Okay, ಅಂದ್ರೆ guaifenesin ಇಂದ ಯಾವುದು much toxicity ಅಥವಾ side effects ಏನಿಲ್ಲ. Sometimes the patient may feel the GI disturbances, that is stomach pain or abdominal pain and diarrhea. Next we'll see about the mucolytics. Here the example for the mucolytics. Mucolytics are nothing but lytics, means the drugs which are used to break down or to reduce the thick mucus secretions. These drugs are mainly used for the serious respiratory tract infections. And next the example for the mucolytics. Here the example for the mucolytics are bromhexine, ambroxol, carbocystine, N-acetylcysteine, carbocystine and N-acetylcysteine. Here the bromhexine, the dose of this bromhexine is, for adults it should be administered 8 mg per TID. Okay, 8 mg per TID andre 3 times in a day. Andre adults ಏನು ಇರ್ತಾರೆ ಅವರಿಗೆ TID 3 times in a day ನ ಕೊಡಬಹುದು. Next children 1 to 5 years ಇರೋರಿಗೆ 4 mg BD ಅಂದ್ರೆ 2 times, 4 mg 2 times. And next children for the 5 to 10 years iroge 4 mg TDS, means 3 times in a day. And next is ambroxol. It is administered 15 to 30 mg TDS. Okay, 15 to 30 mg per kg body weight. Here it is Ambril is administered 30 mg tablet, means it is available in the form of tablet, and ambrolite 30 mg per ml andre 1 ml alli ಎಷ್ಟು ಇರುತ್ತೆ 30 mg. Okay, ambrolite it is available per ml contains that 30 mg of the ambrolite. It is present in the form of the liquid. And next is carbocystine. It is available in the form of the drug name is mucodyne. It is administered 375 mg capsule. Okay, 375 mg capsule form alli irutte. And next 250 mg per 5 ml syrup, means it is available in the form of tablet or the capsule as well as in the syrup forms. And 250 mg 5 ml andre ಒಂದು syrup 5 ml alli ಎಷ್ಟು ಇರುತ್ತೆ 250 mg. ಇದನ್ನ ಇವೆರಡು ಟ್ಯಾಬ್ಲೆಟ್ drugs ಅನ್ನ ಏನಿದೆ ಡಿಪೆಂಡ್ ಆನ್ ದ ಏಜ್ ಗ್ರೂಪ್ ಅಂಡ್ ಬಾಡಿ ವೇಟ್ ಆಫ್ ದ ಪೇಷಂಟ್ಸ್ ಡಿವೈಡ್ ಮಾಡ್ಕೋಬಹುದು. And next is N-acetylcysteine. N-acetylcysteine it is contains the 300 mg per kg, ಅಂದ್ರೆ per kg ಬಾಡಿ ವೇಟ್ ಮೇಲೆ 300 mg ನ ಡಿವೈಡೆಡ್ ಡೋಸ್ ಮಾಡ್ಕೊಂಡು ಕೊಡಬಹುದು. ಮೀನ್ಸ್ 3 ಸೆಪರೇಟ್ ಡೋಸಸ್ ಅಂದ್ರೆ 3 ಸೆಪರೇಟ್ ಅಂದ್ರೆ TDS ಅಂದ್ರೆ daily 3 times in a day administrations ಮಾಡಬಹುದು. Okay, this is the examples within a dose of mucolytics. And next we'll see about the indications in which conditions we should administer the mucolytics. Those are chest congestions. Okay, chest congestions and asthma, emphysema. Emphysema is nothing but fluid filled tissues which are present in the lungs. Okay, the lungs tissues are completely filled with a fluid, and the lungs tissues ಏನಿರುತ್ತೆ fluid ಇಂದ fill ಆಗಿರುತ್ತೆ. Next, bronchitis is nothing but an inflammation of the bronchioles, and cystic fibrosis. Cystic fibrosis is a genetic disorder. And next, atelectasis is nothing but collapse of lungs. Okay, collapse of lungs. And next, COPD is chronic obstructive pulmonary disease. Means all these conditions may comes under the chronic diseases of the respiratory tract. Okay, these are the respiratory tract, the chronic diseases. Means ee ella conditions ella enagutte, obviously there is a severe chest conditions agagutte because of the excessive collection of the mucus. Excessive collection of mucus andre enagutte, there is no proper gaseous exchanges. Okay, one exchange mucus collect andre gaseous exchange proper agi agalla. If there is no proper gaseous exchanges, the person may have the breathing difficulty. Okay, when you administer these drugs, those breathing difficulties are going to reduce by affecting on the mucus secretions. Okay, these are the indications. And next we'll see about the side effect. Side effects means the side effects are more common for the each and every drugs. Those are nausea and vomiting, headache, GI discomfort, and sometimes the patient may feel the hypersensitivity reactions. So those are skin rashes, itching, and facial swelling, and numbness of the tongues. Okay, these are more common side effects. And contraindications, these drugs are contraindicated when the patient is having the hypersensitivity reaction, means allergy towards the particular drugs. ಆ ಒಂದು conditions ಅಲ್ಲಿ drugs ನ administrations ಮಾಡೋ ಹಾಗಿಲ್ಲ. And next, these drugs are contraindicated for the asthma also. Okay, when the patient is having the severe untreatable asthma, these are more contraindicated. And peptic ulcer diseases andre peptic ulcer, GI related diseases enadru idre patients ಗೆ ಅವಾಗ ನೀವು ಆ ಒಂದು ಕಂಡೀಷನ್ಸ್ ಅಲ್ಲಿ mucolytics ನ ಅಡ್ಮಿನಿಸ್ಟ್ರೇಷನ್ಸ್ ಮಾಡೋಂಗಿಲ್ಲ. And next, pregnancy and breastfeeding, and for the children's ಏನಿರುತ್ತೆ pediatrician prior intimation ಇಲ್ಲ ಈ drugs ನ ಅಡ್ಮಿನಿಸ್ಟ್ರೇಷನ್ಸ್ ಮಾಡೋ ಹಾಗಿಲ್ಲ. Next, we'll see about the rules and responsibilities of the nurse after the administrations of the mucolytics. Okay, here the first rule is assess for the dyspnea or the dyspnea. Here, dyspnea is nothing but a difficulty in breathing. Okay, difficulty in breathing andre patients breathing difficulty in severity ಇದೆ ಅಂತ assess ಮಾಡಬೇಕು. Next, assess the frequency, type, sputum of the cough along with the bronchospasm. ಅಂದ್ರೆ ಸ್ಪೂಟಮ್ ಅಂಡ್ ಕಫ್ದು ಫ್ರೀಕ್ವೆನ್ಸಿ ಅಥವಾ ಟೈಪ್ ಯಾವುದಿದೆ ಅಂತ ಅಸೆಸ್ ಮಾಡಬೇಕು. ನರ್ಸಸ್ ಏನ್ ಮಾಡಬೇಕು, ಅಸೆಸ್ ದ ಫ್ರೀಕ್ವೆನ್ಸಿ, ಟೈಪ್ ಅಂಡ್ ಸ್ಪೂಟಮ್ ಆಫ್ ದ ಕಫ್ ಅಲಾಂಗ್ ವಿತ್ ದ ಬ್ರೋಂಕೋಸ್ಪಾಸಮ್, ಸ್ಪಾಸಮ್ ಆಫ್ ದ ಬ್ರೋಂಕಿಯೂಲ್ಸ್ ಅಂದ್ರೆ ನ್ಯಾರೋವಿಂಗ್ ಆಫ್ ದ ಬ್ರೋಂಕಿಯೂಲ್ಸ್. ಓಕೆ, and next is assess the rate and rhythm of respiration. Assess the rate and rhythm of respiration ಅಂದ್ರೆ patients respiratory rate ಏನಿದೆ ನಾರ್ಮಲ್ ಇದೆ ಅಥವಾ ಅಬ್ನಾರ್ಮಲ್ ಇದೆ ಅಂತ ಅಸೆಸ್ ಮಾಡಬೇಕು. And next, assess for the ABG. ABG is nothing but an arterial blood gas analysis. Arterial blood gas analysis in asthma patients with increased CO2 retention. Okay, ABG analysis ಮಾಡಬೇಕು. ಇಲ್ಲ ಅಂದ್ರೆ CO2 is going to retain, means stored inside the lungs. And next, check for the dysrhythmias and increase heart rate and palpitations. Okay, dysrhythmias is nothing but an abnormal pulse rate or an heart rate. Okay, abnormal heart rate, and sometimes the increase after the administration of the drugs, the patient may feel an increased heart rate and palpitations. If the patient is having dysrhythmia or an increased heart rate, obviously he may go for, or he is having the palpitation. Palpitation is nothing but an audible of own heart sounds. Okay, these are the rules and responsibilities of the nurse before and after administration of the mucolytics. So